So hello, everybody. Thank you for joining us today. My name is Richard Corshon with Gavs Tech, and we have an excellent group of panelists with us today. That would be Julia Joe and Dr. Venki Krishnaswamy. So a little bit about myself is I'm originally from the San Francisco Bay Area, so grew up in Silicon Valley and saw a big transformation through the years of being a small town in San Mateo, becoming the Silicon Valley with all the tech startups. And throughout my career, I've worked with healthcare IT organizations since about the year 2000. So I'm going on about 22 years of experience in healthcare IT. I've worked for very large companies like McKesson, where I implemented EMR solutions across the country. I was at Oracle Healthcare and SAP, as well as Microsoft. So I have an extensive experience in healthcare IT from a sales perspective. On a personal note, now I live in Nashville, Tennessee. I work closely with the HIMSS Tennessee chapter as a chapter member here. And I've also co-authored several books. One is AI Sales Revolution, How to Master Sales and Business in the AI Era, as well as a fun project with my daughter. I wrote a children's book using ChatGPT, which is The Adventures of RC and AI, which is a story about a boy and his AI robot who go to Mars to research, study, and then they write a book about Mars. And people had always asked me, how did you write the book using ChatGPT? So I created an app called Build a Book, where it prompts the children or the parents or teachers 8 questions. And with those prompts, it would then ChatGPT would go out and write the book for them and put it in book format. So it's on the App Store if you want to check it out, but it's an interesting project for your children, or if you just wanted to play with it. You're seeing how the technology with OpenAI works. The writing capabilities are amazing. So that's where I start. And then with the panelists here, I'm really pleased to present Dr. Venki Krishnaswamy. Dr. Venki has a PhD in computer science from Yale University and a seasoned executive and entrepreneur with over 25 years experience in disruptive technology. He was founder and CEO of Cupid, which was acquired by Dialpad. And Dr. Venki holds over 50 patents and has co-authored over 50 scholarly papers and is a 2-time winner of the prestigious Thomas Edison Award for his pioneering inventions and the use of AI in unified communications. So, Dr. Venki, if you wanted to say hello, maybe add a few words. Thank you.
Yeah, thanks so much, Richard. It's a total pleasure to be here with this panel and with Julia. So I really look forward to the discussion. Just a little bit more about me. I spent about 25 years in a research career, starting my career at Bell Labs. And a lot of my later research was in fact around AI and communications. And I was involved with AI back when AI was actually a dirty word. It was kind of an underperforming, a perpetually disappointing field. It was almost a laughing stock. So it's just a marvel to see, the field today. It's flipped the other way around. It's almost like it's magic and sometimes scary. So it's just there's just so much possibility here, and I'm really looking forward to this discussion.
Okay, thank you. And we have another excellent panelist I'm pleased to have with us today is Julia Joe. She's the CIO of SyncCare, and Julia brings over 25 years of experience in IT and business intelligence and implementing digital transformation and enterprise-wide modernization strategies that optimize business performance. Julia earned a master's degree in computer science from NYU University and a postgraduate degree in cybersecurity from MIT and an executive education degree from Wharton. And Julia lives a very impressive and exciting personal life where she's a climber, mountaineer, and rescue diver. And she just summited Mount Everest in May of 2022. So amazing person. And Julia, maybe if you wanted to share a little more about yourself, we'd be pleased to hear more.
So first of all, thank you, Richard, and thank you, Gavs, for giving us this opportunity to get everybody together talking about AI, and especially in healthcare setting. And we know that we have a lot of things and work ahead of us. AI, of course, is an interesting field. And I actually started my career 25 plus years ago. And all these 25 years are almost all in healthcare. And AI really is not a new field, as Venki said, because my paper of graduation from one of my master's degree is actually on AI as well. And that was almost 30 years ago. So while I was in healthcare setting of technology field, I experienced a lot of challenges, but a lot of progress as well. So looking forward to this discussion.
Well, thank you very much. So let's just kick off the call, Julia, where we'll kind of start with, why don't you give the audience who's not too familiar with AI, I know it's a buzzword, it's all over the news and everyone's talking about it every day, but why don't you give, a 40,000-foot overview of kind of your thoughts on where AI is today in terms of healthcare and maybe a contact center?
Yes. So I think the artificial intelligence come into a buzzword recently, but actually AI is everywhere in our daily life already, right? So, the individualized, online, Facebooks, and, even Google, all these tools are already implement some sort of AI, machine learning, all the algorithm from way back. So I think it's already in our daily lives, and AI starting to make fundamental changes in healthcare only recently, because I think pandemic put a significant amount of opportunity in the past years for technology to really excel. And in this technology spectrum, and AI stand out because people ask for improve of the quality, improve access, improve individualization, and more importantly, improve patient experience. So for all these add up, AI basically shines during this pandemic, as well as this huge opportunity for healthcare. So we're trying to use AI in many, many different areas, and especially in contact center.
Okay, thank you. And Dr. Venki, would you have anything to add in terms of just an overview from your perspective of AI in healthcare and maybe AI in the contact center?
Yeah, more generally in the contact center, I would say, the last 20 years have been about the quest towards more and more productivity. So we went through a period of, just cost arbitrage through outsourcing and things like that. Then there was kind of, the early wave of automation, especially with IVR and technologies like that, that were about getting simple things done without needing a human to intervene. Where AI is taking us is actually into, so from automation to intelligent automation, first of all, and we are there right now where the chatbots, virtual assistants are getting smarter and smarter. Their capabilities are more than they ever used to be. And they can even do the jobs with brand awareness and sort of empathy almost. So that's where we are. But the promise of AI is really where it's more proactive, it's more insightful, and it's starting to surprise us in going beyond what we even thought we could do with technology, right? And so that's kind of, we are at the cusp of that. And it's going to be really interesting. I mean, there's that promise of technology, but there's also the reality of business in many ways, and in particular realities in healthcare that I'm really looking forward to Julia's views of all the constraints, of all the the things that you have to be careful about, the things that you have to get right, otherwise they're disastrous. So it's going to be very interesting to see as we move into that proactive, intelligent, insightful AI. How does it meet the challenge of what it has to do, what we expect it to do correctly? So I'm looking forward to seeing how that plays out.
And Julia, we talk about how AI can really improve the automation and business processes for the healthcare organizations from both payer and provider perspective, but we also see some opportunities for improvement with the patient experience. So maybe if you or Dr. Venki can add to this, but how is this going to improve a win-win for everybody, where the patient walks away with a better overall experience with ease of use, provide information. We can talk about use cases down the road, but maybe Julia, if you want to give your overview on how you see patient experience improving with AI.
Well, the AI can be improved in many ways. I think it's one of the things that people forgot is it's not everybody have laptops, have computer, has access to, the fancy technology. Especially, I didn't give an overview of SynCare, the current company that I work for at this moment. I mean, SynCare, we are target Black and Brown community. Is established by our CEO, Tony Welters, and he has this mission that is going to try to address health disparity and improve this, social determinants of health situation. So all these mission-driven organization at this moment, there are quite a few out there. I think it's important to provide accessibility to our community who are a little bit technology challenged. So I think in this sense, call center, contact center is going to perform most of the functionalities. When you want to basically get people engaged in your member portal, get engaged in some mobile app, but a lot of things actually can be accomplished through contact center. For example, some of the basic needs, for, I would say, pharmacy renewal, or checking your lab results, for sometimes you reach out to doctors or even nurse practitioners at the time that you need it for some question, and even to get some individualized attention. A lot of things can be accomplished through contact center. And I think it's important to remember that during the interaction with contact center, with the technology, that the contact center can tailor a special dialogue between the patient and the representative, as well as a chatbot, I think you just mentioned. So all these things can be detailed, configured greatly improve our user experience.
Yes, excellent. Yeah, I can give a real world example. So I had a call from a hospital that I had owed a bill for $50 that I didn't know. So, from the time they spent to call me, answer the phone, and say, I have $50 from a procedure I had 6 months ago that I didn't know. But if I had gotten a text message or an email with even a text saying, you owe a bill, pay here, click with your iPhone, pay now with iPay, I think it would have been a lot better experience for me as well. And, do you think, Julia, will ever see the stage where you get to a conversational agent within a chatbot where it becomes then a Q&A session between the patient and the healthcare organizations?
Right. So a lot of times, we forgot, the contact center, the technology really improved, I would say, response time as well. So not to mention the cost savings, and they can have multi-language support too. So a lot of time, these are all the different features can greatly improve the user experience. And at the time, call coming in, and the system can, immediately detect the caller ID, what the caller for, so go back to whatever the setting you configure, that maybe we find out this person has a coming up appointment, or maybe they just have a newly lab result coming out. So all these things can tailor, just like what you mentioned. So system know it ahead of time, and then to tailor their response based on all these information available to them. And so immediately the patient feel like, wow, this system already know me ahead of time. So it's a greatly improved this, patient satisfaction. I think in healthcare, patient satisfaction is the key, and it's the huge gap we're trying to close.
Yeah, and based upon your degree in cybersecurity from MIT, what would you mention or want to say about, people are concerned about cybersecurity or accessing the information in terms of your experience? So what kind of, I know we have different protocols we obviously set up, but what are your thoughts on cybersecurity?
Right. So while we're trying to prove the best, provide the best care to our patient, at the same time, how to handle those data is definitely extremely important to people, technologists like me. So that means when you design the system, when you configure system, when you protect the system, when you store the data, how you're going to store them, where you're going to store them, how you're going to create a policy and procedure, who is going to access them, and when people access them, are they who they say they are? So all these things are going to be steps along the way to protect the information, so we can give the right information to the right person. So all these procedures are very comprehensive, basically, not to mention we have a very comprehensive, we call enterprise defense program within SynCare. So these are the things that are evergreen, that we can never put a stop, because, with the technology improve, so is all the, I would say, other world, like the dark world. So the dark world also improve their technology. So we have to always keep a step ahead.
Excellent. And Dr. Venki, with your experience in some of your patents and pioneering inventions on the use of AI and unified communications, where else do you see the opportunities for improvement with patient experience in the call center?
Yeah, so to me, it's really when we say call center in a healthcare scenario, if you look at the patient's experience, ultimately for the patient, it's about having access to and communication with a doctor, right? And that's a very scarce resource. We all know, we've all had experience with having to wait, weeks or months for appointments, and having questions between appointments that you can't get answers to quickly, and so on. So to me, the promise really is, how can you sort of bring that expertise or insight of the expert closer to the patient, more accessible, faster, and so on. And in some ways, to me, it's that is kind of the evolution of the contact center in healthcare, right? I think we will get better and better at automation. So things like prescription refills or appointment reminders or tests and communications, all of that, I think will get better and better. And those aspects of patient experience will improve almost as a matter of course. But I think the frontier that we'll be looking, I think, for sort of a leap in experience is really access to expert advice, right? And to me, that's kind of right at our fingertips. But AI has the ability to ingest huge amounts of knowledge, extract summaries and insights in a very accurate way, provided it's trained the right way, you give it the right prompts, and you kind of give it the right guardrails, right? So those are the things that I think we need to work on. But assuming we get there, imagine being able to now, for a patient, to be able to get expert advice on side effects, or to talk about a new drug, or clinical trials, or complex symptoms, or progression of symptoms, all of which you don't think in terms of what a contact center does today, but for which you need access to a doctor, and the doctor is a scarce resource. Not everybody in your locality has the expertise. You may have to go to a specialist somewhere else. You don't know who to go to. But imagine having that kind of expertise come closer to you, more accessible. That is the promise of AI, but without what Julia is talking about, guardrails, being able to vet that that AI is doing the right thing in a timely way, and with appropriate level of measurability or compliance, is always going to be a promise. So I think that's kind of where I see the promise of the technology and the challenges we have to overcome to kind of make those promises real.
Yeah, so I've worked on a few pilots and use cases around health literacy and health equity. So do you see the future becoming maybe something, say, like explain my diagnosis or explain my prescriptions? Do you see that AI could take over some of that conversation in a meaningful way?
Absolutely. And I see kind of like the absolute explosion in startup activity in health tech, all moving to that, right? I mean, so we're kind of the pandemic forced on us the imperative to go virtual, right? So televisits now, which had been talked about for 20 years before, now is routine, right? The next step is really at the very least, that pre-qualification of history, symptoms, and so on, and a first level read. And then you can go even further, a co-pilot for the physician themselves, right? So you may be talking to a nurse assistant, or you may be in an emergency room, and they want to treat you right, but they don't have the expertise, and they wish they had access to an expert. That's where I think the kind of co-pilot capabilities of AI, with its ability to ingest large amounts of knowledge and reason about it, I think that can be very, very powerful.
Yes, excellent. And even for some health systems, looking at like discharge instructions or post-surgery, pre-surgery instructions, I think can be useful. I think and then the personal health information, you think that we get a future would be a Q&A session where they could almost speak to a virtual assistant as a Q&A session, or you think it needs to be kept in a small parameter for specific use cases?
I would say that's already happening, in many senses, like you said, pre-qualification for surgery or post-surgery, follow-up instructions, or like a wellness advisor, or even a mental health advisor. I think those things are emerging. So, and they're all definitely being very conversational today. I mean, they're yes, some of them are mobile apps in the mobile app format, but they're all definitely moving to a much more conversational format. And to Julia's point, not everybody is going to be using a computer or a mobile phone or a screen to interact with these. So, having kind of like a voice assistant that's also backed by this kind of knowledge, as well as ability to be conversational, I think is going to be very powerful.
Yeah, I think some of my clients I've worked with, we've been able to automate up to 80% of the calls coming into a call center. So, I mean, there's a huge return on investment. And I think there's a win-win for the patient experience as well. As I mentioned, I don't like to sit on hold, right? And I don't think anyone does. So if we can get the answers we need, that's really what comes to the point, is we need the right answers at the right time, which is immediate, right? No one wants to wait on hold and speak to an agent, and then they may not know the answers anyways, right? So I think there's a huge area of improvement. Julia, do you have anything to share from your experiences that could add? Thank you.
Yes. So I think I just want to basically carry on this conversation. I think AI, although it's old technology, but in many areas it's new, because AI is trained on the data we have available to the tool, right? So a lot of times AI is a continuously learning methodology as well. So basically AI is accurate as the data you feed them. And although it learns very fast, however, it's not 100% accurate, right? Or perfect. So I think definitely, this is type of, as Venki just mentioned, it's important to have a co-pilot. So in a sense of, how we're going to identify, 100% accuracy, for physicians, for nurse practitioners, the technology is emerging. Definitely we're going to resolve some of the staff shortage. We're going to improve the user experience, but at the same time, how we're going to safeguard the quality with some human intervene. So these are very good, I would say, standard practice. And on top of that, I would say any technology comes in, we still need to, follow people, process technology. So even contact center, we need to have a really good staff member still on the job to make sure that the quality is met, as well as the process is followed. So in the word of patient safety, in the word of patient satisfactory, all these things are going to be a teamwork on top of technology. I just want to add that to make sure that people won't forget this is actually a whole teamwork, not just the technology by itself.
Yes. And Dr. Maggie, anything more before we change gears? I want to talk a little bit about rev cycle next, but anything more about the patient experience or patient engagement around the call center? I know we didn't go into too much detail about appointment triage. Maybe if you wanted to explain a little bit about, how we can use AI to leverage that technology and business process in the call center for appointment triage.
Yeah, absolutely. And I want to kind of, re-emphasize what Julia just mentioned. So at the end of the day, it's people process technology. And, regardless of how good AI gets, and we all like ChatGPT and so on, but my sense that in the healthcare context, a patient will, the final kind of, I would say, the most trustable entity for a patient is the doctor. It's a human being, right? And it's not for nothing. It's a bedside manner, a key attribute of doctors. So for all that technology can bring, it's very important to emphasize that we want the technology to make humans better, humans to be able to do their jobs better, more productive, more empathetic, and so on. Because at the end of the day, I think the patient experience is improved when they deal with, when they deal with people who serve them better with empathy and with competence, right? So I think that is the key. So Copilot is part of the technology here, but it's also about training, about getting the people on the front lines comfortable with the technology that's assisting them, or that's providing them answers to deliver to their patients and so on. So it's and especially in the contact center, AI will probably make its way much more powerfully in that form than in being able to fully automate the front end of the patient experience.
Mm-hmm. And Julie, do you have anything to add on just a business process improvement? Maybe it could be an agent assist or other areas.
Yes, absolutely. I think healthcare is people business. So we should never forget that. And people involved in healthcare should have empathy and compassion to people we serve. American healthcare is very comprehensive, too complicated for its own good. So I think too many parties involved, different parties maybe have different objectives. But I think people who work in this industry should have a compassion towards our members. The ultimate goal is we need to make a difference and we need to serve our member better. And because a lot of patients in needs, I saw the passing of my mother, I saw a lot of my relatives, my loved ones in needs of healthcare, and the healthcare quality is not there. It's greatly frustrates me. And we do very hard. A lot of workers, I see their hard work. I saw a lot of people dedicate their time, efforts in this industry. I just want more and more people to have understanding that this is a people's business. It is a people's, it's basically matter in people's lives. Everything, anything that we do is impact some family. And I want this to be deeply rooted in everybody's daily routine, so we can greatly improve the quality, at the same time the process, at the same time the teamwork, so we can improve the outcome of healthcare.
Okay, excellent. Yeah, I think we're all in this for the patient outcomes, right? So, and just in speaking with some of our healthcare organizations, rev cycle is a big issue where they can say, how can AI help automate rev cycle? How can it improve AR days? We talk about prioritizations and claim status checks, cost estimates. I don't know if you really want to explain a little about that, and then we can get Dr. Benke's opinions on where can we rev cycle really help organizations to the bottom line.
Okay, AI is at this moment, I think it's greatly help in all these areas. I mean, the solution for how we're going to close care gaps, how we're going to identify high-risk patients, how we're going to, these are used in advanced analytics already. It's very initial kind of stage of AI. But I think with the improvement of all the Gen AI comes out, I think a lot of these things can be even more adapt to the changes, because CMS also have changes from time to time. The coding changes, the payment model changes, the program changes. All these changes are so overwhelming, and it's very time consuming for our physicians who are already burnt out to learn the new technology, to learn the new changes. So I think it's very important for GenAI to help out in this sense, to get algorithm going, to provide pro tips, to correct the code, to adopt to different changes. So without physicians intervene. So these should be automated in the system to provide easy use for our physician, so they can code right, get paid in timely manner, and provide a service to our patients. So utilize their time to be truly improve the quality of patients' care.
Okay, and Dr. Venki, what are your thoughts on how we can leverage AI in terms of a rev cycle in automating the processes?
So I think probably a couple of ways. One is improving the productivity of each of the workers, right? Some of the examples Julia gave was give time back to the doctors by letting AI handle some of the processes. I think there's probably many examples like that, from scheduling to management of resources within hospitals, critical resources, things like that. Another area that I think, the overall cost to outcome can be affected is by providing proactive care, right? So lots of times, a patient, it's a burden of the patient to interact with the system, and the system often doesn't have availability at the time that the patient needs, right? So there's a lot of inefficiency because of the number of steps it takes to get even a simple question in front of somebody who can resolve it. So I think there's an opportunity for the architecture to be more proactive. For example, if a patient has had a certain kind of treatment, and the course of the progression of that condition is known, then there's no reason AI cannot be proactive in checking up on the patient, or following up, or even kind of taking the first line of question from the patient as part of that treatment, right? Because once the condition and the treatment are set, then there's a certain amount of predictability to what should happen next, and that can be automated either proactively or reactively when the patient comes in. So I think there's a lot of potential in realizing efficiencies by not just kind of giving time back to doctors, but taking steps out of the system, that today require manual back and forth to even get a situation in front of somebody who can resolve it. So lots and lots of opportunities.
And then for a healthcare organization, I'll put this out to both of you, how would you recommend adoption? So if a healthcare organization, everyone's hearing about AI, it's all the news, every vendor now has an AI application. So how would you recommend best practices for a hospital to look at adopting this technology?
Let me go first. So there's, the production of technology is just off the charts now. There's just so much new technology being thrown into the marketplace. So that's a good thing. But there are some very specific patterns that are emerging. So, coming from the startup world and coming from a technology world, for me, the test of whether something is ready for mainstream is really looking at the progression of the vendors that are delivering that, and looking at the health of those vendors, right? So, that's a good indicator of whether the technology is delivering value. So that's so as healthcare organizations assess technologies, assess vendors, assess what they should be adopting, I think it would be helpful for them to have a broader view of what's emerging and what's kind of in some sense winning, right? So I think that's one. The second is to be more systemic about adoption, right? So there's a lot of products out there that solve one problem at a time. And I've seen situations where if you buy too many things that solve one problem and then try to get them to work together, then you get yourself into quite a mess trying to keep everything together. Because at the end of the day, you still need a single source of truth. You need a single source of data. You need to be able to assert compliance and so on. So adopting more of a systemic approach, sort of being thoughtful about the platforms that you adopt, about the fact that they can integrate with each other, that they're extensible, and holding your vendor to account for the performance of the technology that they're sending to you, I think is very, very key. So, doing your due diligence on what's available and what's winning, number one, and number two, being more thoughtful about, about tools and technologies that work together, and and where the vendor can provide proof points of performance or whatever metrics that are important to you as an adopter.
Yeah. Do you see a better approach to pick a specific use case that a hospital is trying to automate with AI, or looking at maybe a more enterprise approach to using AI across the organization? How do you see this playing out?
It's a mixture of the two, frankly. I mean, it's not a one size fits all. Sometimes there is just there's just a problem that's so acute that you have to solve it. I'm sure Julia can speak to this, and solving it kind of makes an immediate difference in multiple dimensions. To your bottom line, to your patient experience, to your staff morale, whatever. So you have to do it because the benefit is so great. At other times, you have to look at, if you already have, for example, systems in place to solve a bunch of things, and now you're looking to improve the state of affairs through adoption of new technology, then you have to be thoughtful. When you put the system together that's in existence today, what were the considerations? Are those considerations still valid today? What have you learned? And then when you apply those, it may guide you to, hey, I want to go slow here, go a little faster here, and be more thoughtful about, building a platform, even if it takes me a little bit longer now, that serves me much longer, right? So I think it's kind of, I think you'll see both kinds of situations.
I would say I will take a different angle for that discussion. I think whatever you mentioned, Nikki, is extremely important, talking about the selection of the technology. So for a healthcare organization, since I've been in many healthcare organizations, bigger ones, smaller ones, startups, in various settings. So I think the fundamental importance to related to AI is first, make sure that you are AI ready. So a lot of organizations, can chase the shiny objects, but ends up the investment not to really deliver the results. And the issue can be in many different areas. So the first area is, as you mentioned, I think the fundamental is, do we have a successful use case? Do we have an extreme a perfect use case to provide this solution? And then we have expected outcome. So you need to know what our problem is, what kind of problem we try to resolve. And at the same time, you have at least some kind of idea of what successful criteria looks like. So you can identify the right solution. And on top of that, we have a problem we try to resolve. Do we have a solution? So is this solution should be the AI? If it is AI, is our organization AI ready? So in the sense of AI ready, we need to make sure our data is correct. We have a framework that we can control the quality of data. We can make sure the data is utilized in the right way. We can make sure that data coming in with a good quality and going out with good quality. And is our infrastructure ready? Is our people culture ready? So these are a couple of main areas for me to consider whether it's going to be a successful implementation for AI solution, especially for a healthcare organization. Because I think another important factor is the right data generate right results. And in healthcare, these right or wrong results, matter to people's lives. So I think it's important to make sure that what we do has a huge responsibility attached to it.
Yeah, excellent. Yeah, I've worked with some payers where we were just able to automate a simple use case. This is like 1.2 million calls a year were coming in for I lost my ID card, right? So there's a huge return on investment for just a simple use like that. But I think you're right, making a history of a global strategy for organization is huge. And anything more to add, Dr. Venki, and then we'll move on to some next topics here.
Yeah, so I would say there's some technologies that are kind of have probably matured enough for healthcare to adopt them, like other contact centers, right? So, for example, you mentioned conversational virtual agents. There's Agent Assist. There's also tools for bucketizing things. So Julia talked about assigning things to the right codes. So tools for call disposition or for guiding the agent or measuring the quality of service delivered, or even simple triage on incoming calls. Those are all things that weren't there like 6 or 7 years ago, but are now mature enough and pretty much table stakes for any contact center to operate. And there is absolutely no reason to hesitate from adopting those. I still see kind of a vast majority of call centers, and in my experience, Julia, I don't know if you'd agree, but healthcare tends to be more cautious than others, so they kind of hold back a little bit on adoption of some of these. But I feel like some of these technologies, there's no reason not to jump into them because they have immediate benefit. They've been proven out and will deliver ROI, right? So while there are many frontiers yet to be conquered, some are mainstream, and there's no reason not to adopt them. That's my view.
Yep, excellent.
Yep, absolutely. I think the new technology definitely going to improve quite a significant advantage in many areas, not to mention improve user experience. But these are machines, right? So machine has a best algorithms, provide results and never tire, right? The physician can get tired, but machines never. So we have really good results coming from machine because they're always very, under expectation, right? So we call it center of excellence. This excellence will come in at all time. So we have many advantages. I think the adoption for healthcare organization of all these new technology facing few challenges. So the number one challenge is data sharing, right? So whether the data sharing can be freely or whether this algorithm can be designed in a way that can be trustworthy. So a lot of times physician doesn't trust machine to give results, especially when it comes to handling their own patients. Second thing, whether the infrastructure is ready, because a lot of healthcare organizations, their system very legacy. So whether it can implement, integrate, so whether it can work seamlessly within the existing workflow, and also the training, the staffing. So who is going to support? Who is going to manage? So all the technology resources, whether they are going to come in as overwhelming learning curve. So these can be some of the challenges, not because they don't want to, but because they have some, I would say, challenges existing in current healthcare, especially some large or even small healthcare organization.
It's interesting, Julie. I was at a seminar in Nashville, and they actually had a study where it said that the virtual assistants were more sympathetic and empathetic than the physicians in terms of interactions through text or chat or voice. So I think in the future, it'd be very interesting. I mean, talking about futures technology, I think within 5 years, we probably won't be able to tell if we're talking to a virtual assistant or a live person. And so it's very interesting, exciting times, in terms of future technology and where this is going. I mean, we're at the cusp of technology that I believe is going to be bigger than the internet in terms of this disruptive technology with AI. And we're seeing this already with the explosion of NVIDIA, right? Going to $900 a share, and just this huge amount of money pouring into this technology because in my opinion, I really think this will be as big as the internet revolution. And do you have anything more to add in terms of, future technology, or where do you see this going? I mean, it's growing so fast, but any ideas, you or Dr. Venki, on the future states or where it's going?
Well, a thought just occurred to me, right? We talk about machines, being competent and humans being empathetic. So, in especially with patient experience, customer experience, I would say, organizations are accustomed to thinking in terms of, do you want competence or do you want empathy, right? So, for a high value customer, let's say, you route them to your best agent because that agent is going to deliver a lot of empathy. But at scale, organizations want to put a lot of investment in virtual assistants and so on, because they can then deliver competent service at scale, right? The very interesting thing that I see with generative AI is that you can actually do both. You can actually have very high levels of competence driven by the reach of the machine in terms of being able to scour a lot of knowledge and reason across millions and billions of data points. But also with with the large language models and the large training sets and sort of advances in prompt engineering, I think we are coming close to being able to deliver human-like properties in conversational entities, right? And then if you go to the next step, and I'm starting to see the emergence of very lifelike video avatars and so on. So I can imagine, just maybe 2-3 years from now, having a very empathetic looking avatar, lifelike avatar that speaks in a soothing voice and delivers extremely competent answers, right? Is that scary or is that great? I don't know, but I can see that happen.
And Julia, we have a question coming in, but do you have anything to add to that?
Oh, definitely. I just have a quick basically summary for this, because I think, with AI, with all these new technology, this is almost feels like the internet boom. So I think the future, the possibility can be endless, right? So a lot of times we were talking about when new technology coming here, many people will be embracing it, but also many people will feel, it's very intimidating. But at the same time, I think, regardless, like it or not, this is force of nature. We're going to this direction, and we need to just make sure it works the way that we would like it to work. So I think those are all the human guardrails or human controls, control in the sense of data, control in the sense of process, control in the sense of safeguarding the outcome. All these things should be under a reasonable control to make sure that this technology utilized to its best benefit.
Okay, so I had a couple of questions come in. So this relates to cybersecurity. So as cybersecurity threats evolve, what proactive measures can healthcare contact centers take to ensure data security and privacy when implementing AI-driven solutions?
Okay, so it's basically vary from organization to organization. So it depends on what kind of business and system that you guys are using. But I think in general, any organization should have a tailored, again, we call enterprise defense program. This defense program should have a framework, a combination of a policy procedure, periodic pen testing, security assessment, knowing where your data at, because a lot of times we use a lot of parties, a third-party solution. So, your party maybe all these vendor maybe store your data somewhere else, and not to mention probably they have subcontractor and they send your data to some other places. So you need to know exactly where your data at so you can protect them. And last but not least, it's extremely important that you have a network operations center and security operations center in place to monitor it 24/7. So the time to identify an incident is extremely important. If we can identify any positive threats in a very timely manner. We can countermeasure, we can segregate, and we can put a lot of remediation in place in a very fast manner. So people in charge of your organization security need to have a very comprehensive defense program in place.
Okay, and then here's another question that came across. Any guidance on how to operationalize AI in contact centers quickly?
I think Becky can take that maybe.
Yeah, so that's it's a good question. So I would say as a general rule, you want to follow a couple of things. One is you always want to back into it people first, right? Because you have your people are the front lines of a contact center. They have experience, they have knowledge, and they have training, and they also have a point of view. So, but having said that, I think in my view, the best approach is to adopt as many elements of the stack as you think you can absorb at one go, right? I mean, there is a temptation to add a feature here or a feature there, but what I've seen is that things can come unglued at the intersection points. Either it's APIs or it's handoff points. For example, I've seen a lot of companies adopt chatbots, but not have a really good solution for when the chatbot, can't do something. What do you do? And then if you don't do that handoff right, you're actually going to be spending more time with the agent than you would if you had sent it to the agent in the first place, right? So I think you want to be thoughtful about those intersection points. And I feel on balance, it's better to get more of the stack from one place because there's a better shot that they've thought through those intersection points in a more platform specific way. And I think you may achieve better results that way. With the caveat, of course, that if there's a very specific pain point that you're trying to solve, and there's a great solution for that pain point that delivers all kinds of metrics right away, then you may have no choice but to adopt it and then figure out later how it fits with the rest of the picture. I think sometimes you have to do that, but in general, I think it's better to look at and it's a good time to do so. A lot of healthcare organizations are looking at moving to cloud, are looking at consolidating their data stacks, are looking at AI as a force multiplier. So it's a good time to say, okay, can I reset and move wholesale to a new platform approach?
Excellent. So we're wrapping up here and close to the hour or so. And any closing statements? Is a very interesting conversation. So I really appreciate your time. It's very exciting times, and we're seeing a disruptive technology that I think in the end will really improve patient care and patient outcomes and the patient experience. So I think it's a trifecta win for all, as well as the health systems. There's a big ROI on automating these processes. So any last minute statements from both of you, and we can wrap up here for the conversation. So Julia, do you want to go first?
Yeah, I can mention, I can only basically, I want to the audience to understand that, in healthcare, it's extremely important to let business drive technology in many sense. Of course, we as a technologist, sometimes we get very much carried away. There's a lot of new technology on the market that we truly just want to, implement and want to make sure that, it is in your organization and, create as much of impact as possible. But at the same time, take your business partner with you. And most of the time, provide them the education that you want them to understand. You want them to know, give them the kind of information that they need to understand what's out there, what is possible, to make sure that they know with technology, with the help of technology, what is impossible can be made possible. So let your business driving the initiation. They will say, can you resolve this problem for me with XYZ? And that will be a perfect storm for technologists to get ahead in, as well as what you guys just mentioned, the question, how we're going to drive the fast operation adoption for a call center from business.
Excellent. Okay, so Dr. Venki, we'll let you wrap up and
Yeah,
hear your
so
thoughts.
first of all, this was an absolute pleasure. Thank you to Gabs, and thank you to Julia for a fabulous discussion. My closing thought would be, we are, Richard, you talked about NVIDIA at 900, right? I mean, that's an example of what the entire industry going through, which is like a hype cycle on steroids. So there's a tendency for almost everybody that I see from the vendor landscape. Unfortunately, I come from the technology space, so I have to say that there's a tendency for vendors to start to promise the stars and the moon, right? So and it's just part of the game because there's just so much promise in this technology that there's people or vendors tend to hype to stand up above the crowd. So as an adopter of the technology, I think you should look for vendors that under promise and over deliver. You should plan carefully. Know that there's a tremendous amount you can achieve as long as you're well educated, you plan properly, and you look for solid vendors who will be your partners for the long haul, as opposed to chasing the huge number of shiny objects that are out there.
Mm-hmm. Excellent. So thank you all. This was a very informative and exciting discussion. And if you have any questions, you can reach out to us at inquiry@gavstex.com, and we'd be happy to have a one-on-one conversation with you. So hope you all have a great day and stay safe, and we'll talk soon. Thank you again, Julie and Dr. Venki.
Thank you.
Thank you.
Okay, bye.
Bye.